So the first thing you're going to do when you're getting over fear is using the techniques that I've talked about in the past. The second thing is when you're just starting IVs, have someone that's good at starting IVs go with you. The person that's good at IVs can give you feedback after you've gotten it, or if you didn't get it, give you good constructive criticism to get better. And this person can also help stabilize the patient's arm, so if the patient has a tremor even, or if the patient's fearful of needles and keeps buckling their elbow, this is super helpful. The third thing is, if you don't get the IV and you ask someone to get it for you, you go with them and you watch them. This one's particularly important because perhaps you go in and you see them go for a vein that you would have never thought of going for. And you watch them to see what they do and techniques that they use to get it. The fourth thing is let the patient know where you plan on going. Ask them if they've had an IV there before or if they've donated blood in the past. If the patient reports, yes, I've had IVs there, but half the time they don't get it, half the time they get it, that might not be the best place to go. And a lot of times what I notice is that younger patients that donate blood a lot, they always get it out of their AC, and it can feel like a great AC. And the AC will feel so good, and you're like, yes, I'm going to go there, but it's full of scar tissue, and it doesn't want to thread. So getting patient feedback is so important because these patients that are in and out of ERs or in and out of hospitals know where they've had successful IVs. And last but not least, number 5 is when you go into the room, it matters what you say. You don't want to say, I'm here to try to start your IV, or I'm here to look to see if I can start your IV.